At Running With Us, one of the most common questions we see popping into our inbox from runners is, I've got a niggle, what should I do? Well, we'd strongly advise that you don't just try and get a diagnosis off the internet. Look, we'll so commonly say to runners, we can't diagnose your knee niggle or your hip problem via an email. We'd like you to go and see a physiotherapist to get it diagnosed properly, and that's crucially important because actually the individual rehabilitation exercises for different injuries are totally diverse and totally separate and actually totally individual to you. So check it out with an expert. If you feel that actually you're able to go and run relatively pain-free or cross-train pain-free, and perhaps those pain levels are 1 or 2 out of 10 and it feels okay and it's not getting worse as you run, well, maybe actually it's a case of saying you might back off some of the intensity in your running training plan and be patient with your body to ensure that that kind of light area of niggle or pain doesn't translate into it becoming an injury, but actually you stick broadly on the frequency of training you normally would. One of the other options to you, provided it doesn't hurt when you're doing it, is cross-training. We've talked about that in some of our other videos. You might get on an elliptical, on a bike, perhaps aqua jogging in the pool, and provided you can do that pain-free, it's a great way to continue your running training and building up your cardiovascular fitness without the impact that running can have. Doing that for 3, 4, 5 days might be enough to allow you to just get over those small little tweaks or niggles that actually runners commonly do feel day in, day out in their training year. But actually, if that running injury is something a bit more serious, and being honest with yourself, it's more like a 4 or a 5 out of 10, or perhaps it does get more painful as you move through the course of that run or that cross-training session, it really is time to back off, listen to your body, and perhaps actually take a few days rest, and it can make all the difference. But we'd say as running coaches, please don't just trawl internet forums for a bit of generic advice. Go and see a specialist, go and see an expert, and get some real live advice that relates to you. You'll get back running much quicker that way.